Today we're going to be talking to you about simulation for healthcare students and the lessons that we have learned from COVID-19. My name is Dr. Ursula Rolfe and this presentation is in partnership with Professor Debbie Holly. To give you a little bit of background, higher education institutes that deliver education and clinical skills training to healthcare students in the United Kingdom have had to do a lot of reconfiguration in terms of educational delivery due to the implementation of 3 national lockdowns that we experienced from March 2020 to March 2021. Bournemouth University, which is where we work, offers a wide variety of healthcare degrees ranging from undergraduate degrees in adult and child nursing to paramedic science. And all these degrees consist of theoretical and practical components. Whilst it remains relatively easy to move from face-to-face to online theoretical delivery using Teams and Zoom, addressing the practical components of our courses, which included clinical skills and students attending National Health Service Trust for Practical Experience, was far more difficult, and that's what we'd like to share with you today. To address this change in educational pedagogy, we embarked on a variety of online and virtual reality simulation projects. Now, it's important to discuss the context around preparing healthcare workforce to deliver into the digital future, and we feel that simulation is a valuable way of enhancing technology and improving patient care and safety, and with the support of remote facilitation, which we had to use during lockdown and during COVID, it has been shown to significantly improve the performance of our healthcare learners. We use immersive technologies such as VR, and these kind of technologies can revolutionize healthcare education and offer new and innovative ways to engage our students, which we hadn't thought of before COVID. Our project consisted of 3 pilot projects, and these pilot projects were funded by an organisation called Health Education England, which also funds the National Health Care Service of our country. And we were able to fund these projects through this funding by using 3 different examples, and we created 3 pilot projects. One was a reflective tools for paramedic students. Another was using a 360-degree camera to film child nursing student scenarios. And the third and final one was using online case studies for adult nurses. Our first pilot project involved our child nursing students, and we called this project Assessing Baby Robin. And it was aimed at using a 360-degree video and camera accessed via Google Cardboard and Oculus Quest headsets to scale a clinical simulation experience for our child nursing students. Evaluation of this pilot project showed that using virtual simulation helped prepare our students for in-person simulation, saved face-to-face time, and allowed students to access this platform at times that were most suitable to them. We then embarked on an underground scenario as COVID really took hold in the UK, and we moved to a car park scenario using our paramedic students, which we aptly called Martian Attack. These were for our first year paramedic students, and the project was aimed to reconceptualize simulation during COVID, where we created a short video setting the scene for clinical tasks for our first year paramedic students and what they needed to achieve. And a lot of these tasks centered around teamwork, team initiatives, communication tools, and also assessing a patient. We used 365-degree film clips, which captured these simulated scenarios and debriefs, and they were added onto a virtual platform which was hosted by Panopto so that students could reflect on the scenarios in their own time, and then this aided their learning and reflection. The film clips were accessible through a range of technologies from Google Cardboard to Oculus Quest headsets and added a high fidelity aspect to realism for the students' learning experience, and the feedback that we received from these was really excellent. The third and final project in our particular remit was around using virtual simulation case studies hosted by Laerdal. And these case studies were used to prepare learning through online resources for our nursing students, particularly around how to recognize and respond to deteriorating patients in a timely manner. The case studies included anaphylaxis, acute exacerbation of asthma, chronic obstructive pulmonary edema, and blood transfusion. And this pilot's work has been published and evidence that virtual simulation has had a significant effect on improving our students' knowledge and clinical skills amongst the cohort, whilst also learning to recognize and respond to deteriorating patients. We were then able to learn lessons from these particular pilot projects on how to implement this in a far greater way, and we were able, post-COVID, to upscale some of our simulation ideas into what we call a major incident scenario. And I'm just going to play you an introductory video clip of what we use to inform our students around a major incident where our paramedic students, nursing students, and child healthcare students had to respond and deal with a variety of different scenarios set aside to them, which also met with the intended learning outcomes of their particular unit.
Coming soon.
This is the video that students first were given. In order to set the scene, we used Godzilla as a major incident scenario, and the students were then set out various tasks to respond to what would be a simulated major incident. We also included external organizations and practice partners, and the feedback has been extremely positive. In fact, so much so that this is going to become an annual faculty-wide event. I suppose the next thing to consider, and one of the most important ones as well, is the opportunities that we've had to build bridges with our practice partners. Our practice partners included the air ambulance, the paramedic trusts, and the National Health Service trusts that we work with. We were also able to link to our master's degree students in the Arts University at Bournemouth Arts University, and we also then filmed bespoke scenarios for early year child nursing students, mental health nursing students, adult nursing students, social work, and occupational health students. So this was really a greater faculty experience for all students and staff, and we couldn't have done a lot of the work without the impact and enthusiasm of our students that took part. Final thoughts on what we have learned from COVID-19. We really pride ourselves on delivering quality of health education graduates when they enter the NHS workforce. It's very important to us that these future workforce students are the best quality that we can get them to be. But standing still post-COVID, we will still not meet all the NHS aspirations. So we need to use alternative scenarios, especially including digital work and simulation work, to enable our workforce to continue to grow. And authentic assessment really is key. We are revisiting our curricula to explore this and to implement simulation across departments and the faculty. Excellent learning design works for students to experience some of these particular scenarios online also include a blended learning approach with face-to-face and then implementing some of the online tools into practical sessions that we still do in terms of face-to-face scenarios and assessments. Simulation is really building effective bridges for us between our students and their placements in healthcare settings. Simulation is really the future of our healthcare and has grown significantly in the last few years. It also provides an interesting and dynamic alternative to face-to-face didactic teaching, as evidenced by the lessons that we've learned during COVID-19. It's created new opportunities for us to use and deliver simulation to our students. It can also help to redesign models of care and support student redeployment, as was evidenced during this pandemic. And the pilot projects that I mentioned briefly provided a basis for further external investment. Simulation can also extensively contribute to how we support delivery of healthcare to our future workforce that is safe, of high quality, and promotes improvement within the health and care systems in the UK and further afield. I welcome any questions that you have.